Hi, my name is Samantha Abercrombie, and I am presenting my Quality Improvement Initiative implementation of a postpartum depression screening protocol for NU 715 Innovative Leadership and Collaboration in Healthcare. The mission, vision, and values for the organization where the Quality Improvement Initiative will take place includes to provide high-quality care and coordinated services that improve the health of the community. The vision is to be the community hospital of choice consistently recognized for clinical and service excellence. And values are safety, compassion, integrity, excellence, innovation, accountability, diversity, and inclusion. The vision for practice includes to integrate best evidence-based practice to enhance patient outcomes by improving the identification of postpartum depression, also referred to as PPD, and increasing referrals to case management. The vision aligns with the core values of the organization in that it provides high-quality care that will improve the health of the community and the patients it serves. The Quality Improvement Team consists of team leaders, which is the DNP student and the Director of Obstetrical Services. The Quality Improvement Committee, also referred to as the stakeholders, consists of the nurse educator for the obstetrical unit, your charge nurses, and 2 staff members that are volunteering for the stakeholder committee. Responsibilities of the committee include assisting in developing the PPD screening protocol and educating staff members on the clinical manifestations of PPD and the screening process. The meeting structure is based on a team-based approach that encourages open communication. Weekly meetings will be held every Tuesday in the director's office with the option for a virtual platform as well. The process will be reviewed by the unit director and nurse educator after project implementation each year prior to the annual skills fair. The issue identified is that there is currently no postpartum depression screening protocol in place within the organization. This practice does not meet the guidelines established by the American College of Obstetricians and Gynecologists, also referred to as ACOG, that recommended all obstetric care providers complete screening for PPD with a validated screening tool. PPD is recognized as a global issue as it affects hundreds of millions women annually. It is estimated that 13.4% of women experience PPD in the United States, while Alabama has the highest percentage of PPD in the United States, as 23.5% of women experience PPD. The purpose of the initiative is to implement a PPD screening protocol and improve the identification of PPD during the postpartum period and increase referrals for postpartum depression to case management. The plan of action for the Quality Improvement Initiative utilizes the Plan, Do, Study, Act cycle, also referred to as PDSA. In that plan, a protocol and policy will be developed that guides the PPD screening. Training seminars will be conducted for nursing staff that includes the clinical manifestations of PPD and training for implementing the PPD screening tool. Postpartum patients will be screened for postpartum depression 24 to 48 hours after delivery of the infant, and case management referrals will be ordered for patients that score greater than 9 on the PPD screening tool. Implementation of the PPD screening tool will not require any financial cost or specific resources to the organization. Early intervention for PPD will decrease healthcare costs by decreasing healthcare stays related to PPD. The protocol will enhance patient outcomes by increasing early identification and promoting early treatment for PPD. Protocol compliance will be evaluated by completing chart audits once weekly during implementation by the DNP student. The number of positive screens and case management referrals will be documented. Performance measurement will be evaluated using a quantitative design and will include the total number of postpartum patients screened with appropriate referral to case management before discharge. Chart audits will be completed weekly during implementation to ensure nurse compliance with the PPD screening protocol. The total number of case management referrals after project implementation will be compared to the number of referrals before implementation. Project updates and education will be presented during training sessions, weekly staff huddles, education boards, and monthly staff meetings. Stakeholder meetings will be held weekly to communicate project updates and results to staff members and hospital leadership. Postpartum nurses will communicate the PPD screening process to patients prior to the PPD screening. For this quality improvement project, education will be presented during training sessions, staff huddles, and monthly staff meetings. Flyers will be distributed throughout the unit to alert staff of training sessions. Knowledge gained during the education process includes clinical manifestations of postpartum depression, process for the postpartum depression screening protocol, and mental health resources for PPD that will be provided to the patient. PPD screening data will be collected using a validated postpartum depression screening scale. Screening results will be entered onto a data collection spreadsheet and then entered into the electronic health record. The total number of case management referrals after project implementation will be compared to the number of referrals before implementation. Evaluating how well it was implemented includes stakeholder meetings being held weekly during implementation to discuss the quality improvement plan process. Staff surveys will be completed post-implementation to evaluate the staff's perception of how well the plan was implemented. This concludes the Quality Improvement Initiative presentation today. Thank you.